So as we were discussing in the last part about the anatomy of the stomach, so now here is a esophagus था, ठीक है, and then there is starting of the stomach, but before that in between them is a sphincter, that is the cardiac sphincter, and then after that it is the stomach, and stomach के बाद the next part, the small intestine starts with the duodenum, but again between the stomach and the duodenum is a sphincter known as the pyloric sphincter. After that there are two curvatures in the stomach, that is the greater and the lesser. Lesser means, as the name suggests, is a short and on the posterior surface of the stomach it is there, on the posterior surface of the stomach, whereas the greater is on the lying interiorly. So imagine this is a stomach and here is the esophagus and this is the cardiac sphincter as we have discussed above. So the for the greater curvature, the line moves towards this and upwards, interiorly upwards, and then curves downwards. So here it is the greater curvature, and then there is a pyloric sphincter for just knowledge of this, and then this is, we can say, the duodenum and all that. So from this pyloric sphincter, the lesser curvature turns upwards immediately, otherwise it is downwards, but it turns upwards immediately to complete the J shape like this. And so this is basically this portion is the lesser curvature like this. Okay, so this was the anatomy of the stomach. Okay, and we can say that this part is the fundus of the stomach. Fundus, we all know that is like this. Okay, and then नीचे pylorus और यहाँ तो हमारा duodenum था. Okay, and this is, we can say, is the body of the stomach, and in its ruges are present like this. And so pyloric sphincter, अब ये एक rough सा diagram है, not exactly we can say it like it is, like I show you the diagram. So it is basically like this. This is the esophagus coming, and this is the cardiac sphincter here, then the fundus, then slightly anteriorly upwards is this is the, and curving then downwards is the greater curvature. Then here the duodenum starts, so between it will be pyloric sphincter, and here the then lesser curvature moves upwards to complete the J shape of the stomach, and it is body and ruges in it. And here